Watch this.
Once again, Idaho is calling on the National Guard to help get a handle on COVID, and they're heading back to the hospitals to help overwhelmed healthcare workers. If it all sounds familiar, well, you're not wrong. With hospitals nearly full, the sick and injured are turning to places like primary health for care. But they say they're over capacity too, and it's taking its toll. Some school districts are starting to see more COVID cases, one district even changing its mask policy less than 2 weeks into the school year, as more students are calling out sick, and another shut its doors completely in an effort to stop the spread. We've been at this pandemic thing a long time. Remember when there were some that were planning on it being over after just a few weeks? Well, here we are, nearly 18 months later, and more than a handful of coronavirus variants. Well, today, Governor Brad Little announced to the state, we are now at the point of a last-ditch effort when it comes to Idaho's COVID mitigation plan. This last-ditch effort is to avoid a first-time-in-Idaho catastrophe, a statewide crisis standards of care declaration. The plan is to add hundreds of new medical personnel to Idaho's hospitals. But it's not like we can just order more from Amazon or just take them out of storage. These new medical personnel will be in the form of Idaho National Guard soldiers, as well as contracted employees the state is bringing in to help hospitals who are facing a lot of challenges right now. A short time ago, state healthcare experts echoed what Governor Little said. We are teetering on the edge of the worst situation our hospitals have seen since COVID hit Idaho back in March of 2020. And some would argue, Joe, the first time ever in the state of Idaho we've ever gotten this close to crisis standards of care. So how bad is it from both the healthcare perspective and the commander-in-chief perspective?
Well, Brian, before we set the stage for our conversation, first I want to just check in real quickly on what Governor Little said this afternoon. This is how he described the current situation we're in.
We are dangerously close to activating statewide crisis standards of care, a historic step that means Idahoans in need of health care could receive a lesser standard of care or may be turned away altogether.
Okay, so that was a big statement, but shortly after that, he also said that we are pulling out all the stops with this announcement today when it comes to this pandemic. But the question we've seen a lot of, and we want to know ourselves, are we though?
Yeah, and this has been a conversation on social media in our community since Governor Little said today, again, we're pulling out all the stops to face COVID. So let's take a look at the situation we're in right now, and we're going to compare it to last fall when really we were in a very similar situation. Right. The National Guard was being called out. This was all being handled differently now compared to then. So let's take a look at November 13th, 2020. Governor Little announced then, Brian, for the first time that he was activating the National Guard to help the medical system in Idaho handle COVID. It was a new and different challenge at that point. So here's where we sat. This is November 13th, 2020. There were 1,519 new cases of COVID, 82 people confirmed with COVID in Idaho's ICUs, and the state was moved to a modified stage 2 restriction. Remember stage 2? Let's take a look. Remember, this was stage 2. This was about a year ago. Restrictions at that point: no gatherings of more than 10 people. At-risk Idahoans were asked to completely self-isolate. All Idahoans were encouraged to telework at that time, and mask use was continued to be required at long-term care facilities. And a lot of people remember this: bars, nightclubs, and restaurants, they needed to operate with seating only. So again, that was November 2020. Let's take a look at today. Here's how we compare from last year to now. The latest daily case count for COVID, 873 new cases. That is down from about a year ago. Now, the big data point here is the ICU capacity. And at the last full report from Idaho hospitals, that was on August 29th, a few days ago, we had 160 people confirmed with COVID in our ICU statewide. And that is double the amount we saw in November of 2020, again, when the healthcare system began to see major challenges, and up until this point, the biggest challenges it's seen. Right now, we're in stage 4, and as many of you may know, there's essentially no COVID restrictions if you compare stage 4 to stage 2.
Joe, before you go any further, I want to leave this up here for just a second because that's a big number. 82 confirmed COVID patients back in November of 2020, 160 now. And you can see the COVID cases also kind of the opposite, right? We've been told over and over, the COVID case number isn't the most important number, but it is when it comes, the number that is, that COVID ICU patient number.
Right, because those COVID cases may not necessarily translate to people going to the hospital, but we can say for a fact, if you have 160 COVID ICU patients statewide, you need to deal with those people, and you need to make sure you have the resources in terms of the physical space and the staff to handle that. Of course, the major headline today also, Brian, is that Governor Little called up National Guardsmen again. You can see on the graphic there the difference between the situation in November 2020 and August 2021. The situation is political now, Brian, and we know that. Masks and vaccines, a lot of the time it may not even be about the science when politicians are talking. This is the way it went. The entire situation has been politicized. Now, that thought was reflected today when Idaho Health and Welfare Director Dave Jepson addressed scientific health recommendations in regards to the current situation. Again, people are asking, are we really pulling out all the stops?
Right.
Could the state of Idaho be doing more? Well, spoiler, according to Director Jepson, it sounds like his recommendations go further than pulling out all the stops from a political angle. Here's what he had to say.
We are actually recommending that people follow the CDC guidance, which lays out some clear guidance around if you're indoors, you should wear a mask and you should practice some physically distancing while you're indoors as well. But the main tool we have is vaccination. We didn't have that last time, and that's where the bulk of our focus is. At this point in time.
And that really is the big difference between now and November of 2020 is we do have the vaccine now, but as we showed you in the graphic a minute ago, despite a vaccine, we have doubled the ICU capacity, or excuse me, population, compared to a time that was considered very dangerous and scary from Idaho healthcare providers. So the question being, did we really pull out all the stops today? To answer that, there could be more done. That's the truth. The governor could go further and do more. He has the option to do that. He stopped short of doing that, but we heard from the Director of Health and Welfare for the state of Idaho. They're recommending steps further, including masking inside. The governor has the power to take action to do things beyond what's going on today, but we'll leave it at that.
So the other number to pay attention to, those numbers back in November 2020 in the ICU, people were much older in that age range. The vaccine came out starting with the older people, dropping it down. The number that they're seeing in the ICUs now, down into around the 40s. The average age of people in Idaho hospitals and ICUs in the 40s right now.
And real quickly, just this afternoon, Brian, the Department of Health and Welfare said that they are seeing an increase of people being admitted to the hospital, younger people, those that can't be vaccinated, age 5 to 12. So something we're keeping an eye on.
All right, thank you very much, Joe. So that brings us to this. Now stop me if you've heard this before. It's a little phrase Governor Little could have squeezed into his announcement today, that stop me if you've heard this before. Quite a few times, in fact. In fact, before his scheduled start at 12:30, there was a Twitter thread going around that made reference to exactly that. The thread contained a link to something titled Governor Brad Little's Personal Responsibility Bingo Card, meaning we could probably guess what Governor Little was going to say today in regards to the pandemic. Because, well, he's said some of the same sentences and phrases before in some form or another, and in some cases, in the exact same fashion.
That is why I maintain that this comes down to personal responsibility. As Idahoans, we pride ourselves on our independent spirit, a quality that defines our way of life. I continue to have great confidence in the people of Idaho to do the right thing, to protect themselves and their loved ones during this challenging time. The COVID vaccine has been tested.
The COVID vaccine is safe and effective.
We need more Idahoans to choose to get vaccinated.
Receive the vaccine if our kids have a chance at a normal school year.
There are many of our family members, neighbors, and friends who are on the fence about getting the vaccine. A lot of others who are on the fence about receiving the vaccine or have just been putting it off. To those fellow Idahoans, to those friends and neighbors of ours waiting to receive the vaccine, the time to get the vaccine is now.
So yeah, stop me if you've heard this before. That bingo card, by the way, 4x4, 16 squares of situations and sentences that we've all heard before. Today, well, we marked off 7 on our card. Good enough to almost hit bingo twice. What wasn't on any of those bingo cards, and you heard Joe talk about it just a bit ago, the word mandate. Because Idaho has never had a statewide mandate to wear masks or get a vaccine or even show proof of one to access any state building or program. And at this point, we likely never will. One more thing you can choose to bet on. Choose, that is. This won't be the last we hear from Governor Little during this pandemic, even if you have heard it before. Okay, so this plea from Governor Little is based on what's happening within our hospitals and healthcare clinics. Running out of beds and space to put those beds. filled with more patients than staff to care for them. And it's not just in the major hospitals with intensive care units. Yesterday, Primary Health Medical Group set a record in terms of the number of patients seen. The number of patients coming in to get treated or tested for COVID is in the thousands daily. And they tell us their medical staff just can't keep up. So instead of increasing that staff, which isn't readily available, Primary Health is decreasing their hours to give their people a break. Here's Katya Stepovic.
Thanks for calling Primary Health Oberlin.
The phones are ringing off the hook.
Direct contact.
And luckily, today, most of them are being answered.
Do you have symptoms or no symptoms?
But that hasn't been the case lately, as Primary Health continues to set records on the number of patient visits daily.
Have you ever seen this clinic this busy before?
No, I have not. And I've been here almost 4 years at the Oberlin Clinic.
Doctors, nurses, and administrative staff don't mind the rare lull of patient influx Tuesday because lately there's been no such thing as a lunch break.
So normally all of our rooms are full. As I said, we're bringing patients in the back door that are respiratory and bringing them into the actual rooms to be seen by our providers.
Yep, right in here.
There's only so much you can do when you're frustrated with just the entire environment of having to see patient after patient after patient after patient and sicker and sicker and sicker and sicker. It is hard.
We are overwhelmed by the number of patients that need to be seen and need to be tested.
CEO of Primary Health Medical Group, Dr. David Peterman, says staff are having to turn patients away, something that's never been done before, not even at the peak of COVID cases last year.
We are getting to the point where we just physically can't see anymore.
What does it mean for the hospitals when you guys are at capacity and having to sometimes turn away patients? What does that mean for the hospitals? How can you help?
It's difficult for all of us. We're doing everything we can to see the patients here who are, mildly symptomatic. Obviously, we get some of the sicker patients, and unfortunately, we do have to send some of them to the hospital because there's things here that we're not able to provide that the hospitals provide. We just have to all work together. It's hard right now.
Monday, Primary Health saw a record number of urgent care patients, over 2,000 of them. 75% of patients were being seen for COVID. With longer wait times and overwhelmed phone systems, the urgent care facilities will now close an hour early to help medical staff catch up.
We've consistently just seen the numbers go up and up and up.
It's 12:30 and I'm looking at this bag of used protective wear, and that's pretty, that's substantial.
Yeah, well, and that's, we probably, yesterday, I think I swapped that bag out 3 times. Wow. So and then we have another one in the back too, and then of course we have the providers that are gowning up as well, and so there's several locations like that. It's busy.
With hospitals on the brink of divert and urgent care's overcapacity, medical experts once again plead with the community to step up.
We are at a crisis, and you can help us. And the way to help us is to wear masks to protect you and to protect others, particularly when you're indoors. And if you're eligible for vaccination, please get vaccinated. We are turning away people who are ill because we just can't see everyone. I am very sad to have to say to the public, to our patients, that we can't see everyone.
75 minutes, but right now it could take up to 2 hours. As for vaccination rates, they're administering about 120 first doses a day, which according to Peterman is a slight increase, but overall he says it's very disappointing.
And that wait time is just going to get longer with them decreasing their hours and such. And hopefully, as Governor Little announced today, some help is on the way with both National Guard, but also he said he's going to try to ease restrictions on nursing students coming out and getting back in or getting into the workforce right out of school. So we'll see if that has any play in this at all. Thank you, Katya. 2 weeks into the new school year, and cases and quarantines continue to rise in schools. So much so that one district is already reversing course on its mask requirement, and another has shut down its building for a week. All right, before you text us and tell us to stop talking about COVID, just stop and delete that text. Start over. We get it, but we're not going to stop talking about it. So, you want to share some good news? Well, you can do that. Just text it to us. 208-321-5614. Make sure you include your name and the hashtag the 208. We are going to share a few of them at the end of the show.
All those in favor of the staff and students masking until the end of the first quarter, October 14th, please say aye. Aye. Okay, any opposed, nay? Nay. Okay, so the ayes have won. Motion passes.
12 days into the new school year, Caldwell School District has already had to strengthen its mask policy because of an increase in absences. At the start of the school year, the district recommended students and staff wear masks indoors. Now, they're moving to masks required indoors, regardless of vaccination status. The Board of Trustees held a special board meeting last night where they heard from school principals about what they are seeing.
It just seems to be snowballing rather quickly. We recognize that the masks are making a difference in protection. And unlike last year when we went through this, I really didn't have any proof of substantial spread in our building. But this year I can say that that is not the case. I've got evidence that we're experiencing spread in our building.
And you can kind of tell, they're not really saying it in that soundbite there, but you can tell they're talking about cases of coronavirus, even though in the meeting they couldn't get a complete picture of confirmed cases because for many instances, if a kid came into the nurse's office with sniffles, they sent him home. If there was contact with a confirmed case in a classroom, they sent him home. They weren't taking any chances. Most of the principals told the board last night as the absences piled up, it gets more and more difficult to find out why, just because of the sheer volume of the number of kids that are out. So the decision wasn't based completely on confirmed COVID cases, but they did have a pretty good idea it was running rampant. These are the number of students in class in each school in the district versus the student population in the last few days. Previously, the board had voted to require masks in schools with more than 10% of the student body absent, meaning if it went above 10%, they were going to require masks in schools. And they did that last week with 3 schools, Caldwell High, as well as Washington and Lincoln Elementary. You can see now, every school is above that number, that 10% barrier. Lincoln Elementary School has 29% of the school absent. Van Buren, Sacagawea Elementary Schools, as well as Jefferson Junior High, 25% students called out. The lowest would be Syringa, with just 11%. We mentioned the 2 elementary schools and the high school already under the mask mandate. Well, we also learned in last night's meeting, a 4th school, Wilson Elementary, was added to that list last Friday because of a high number of confirmed COVID cases. Well, now it's a district-wide requirement. And again, it will go into effect tomorrow through at least the end of the first quarter on October 14th. And then at that point, the school board will reassess. Okay, so Caldwell's just one of Idaho's 156 school districts and charter schools, one of nearly 24 in the Treasure Valley alone. So how are the other schools faring? Are they seeing similar numbers? From our research, it's not as bad as what's going on out in Caldwell, but to be completely transparent, It's kind of hard to tell and get a complete number because of the way each district reports cases, if they publicly report them at all. Take the Boise School District, for example. They've had a mask mandate since the start of the school year, back on August 16th. And so far, just this week, there have been 49 cases within the Boise School District. Last week, that number was 56, and we're only just 2 days into the school week. That's a total of 119 cases. So far, 13 schools have reported no cases in the Boise School District. West Ada, which has been back in the classroom for, 4 whole days after today, they have reported 31 cases, 5 staff and 26 students. And you can see how those break down there on your screen. In Nampa, they've had 42 cases so far this week, 3 staff and 39 students. Last week, they had 67 cases, 9 of them were staff, 58 of them were students. Middleton School District last week reported 9 total cases. And again, you can see the breakdown there by school. We reached out to the Kuna School District for their numbers, but have yet to hear back. Not included in this list is Compass Charter School in Meridian. They actually closed the school yesterday for the rest of this week until after this Labor Day weekend because of a COVID outbreak within the school. Students are expected to return back to the building next Tuesday. All right, final minute or so of the show. We got a couple of text messages asking about the percentage of those vaccinated versus unvaccinated, both in the hospitals and in the ICU, like this one here. What are the percentages of vaccinated to non-vaccinated that are in the ICU and in the hospitals? What we've been hearing for a long time now, since this surge has started, it's been about 95% and above, depending on the day and the week. Some places, 98% of those in the hospital, in the ICU, unvaccinated, whether they chose not to be or sometimes they just can't be, and that is the problem with some of the vaccinations out there. Brian Keeves, please keep reporting on COVID. There are a lot of us that have health problems, surgeries being put off. We should not have to keep hearing this, but unless we get vaccinated and mask up, we're all going to suffer from this, says Chuck. Yeah, it's not just the COVID that this is affecting, or those with COVID. It's affecting everybody now that it's affecting the hospitals and our healthcare system the way it is now. I don't appreciate you criticizing our governor over his news conference. What does it do to help our situation? Well, that's a good question for the governor, too. We'll see you tomorrow.